We're going to talk about some medical information that you need to know. One of the great things about living in our community is that we have a world-class medical and healthcare community thanks to Vidant Health. And this morning we have a neurosurgeon in the studio with us, Dr. Richard Daluai. Did I pronounce it right?
Yes, thank you.
Who is at Vidant Neurosurgery. Good morning, sir. How are you?
Good morning. Doing great. Happy to be here.
We were just thinking about this. I mean, it's Friday, and we're trying to get happy about stuff, but you deal with stuff that's not so happy all the time because you deal with aneurysms.
That's right.
But you hear about aneurysms all the time, and of course, it's something that we all need to be thinking about and the impact on our brain health. Tell us about it.
So cerebral aneurysms are these blisters or these balloons that are on the end of the vessels on our arteries in our brain. And we get concerned about them because with high blood pressure or for several reasons they could burst and bleed in the brain, and that can be a life-ending event. About a third of patients pass away from having an aneurysm when they do rupture. So ideally we like to find these before they rupture, to do something before that event. So that we could prevent, like you said, a bad outcome.
So are there any telltale signs about someone who might be at risk for an aneurysm?
Yeah, the biggest one is the aneurysms do run in families. So we see patients that, their mother, their aunt, it's predominantly, we see slightly more women with aneurysms than men, but they do run in families. So there are some warning signs. Some patients before an aneurysm ruptures, they have a severe headache, a different change in their headaches over a couple weeks. Sometimes patients have some double vision, or they notice that their pupil in their eye is dilated. It doesn't kind of constrict to light like it used to. There's subtle signs, but a lot of times we don't know that we have an aneurysm. It's about 2 to 4% of the population of Americans have an aneurysm.
No kidding, that's pretty high.
It is when you think about all the
And the outcome can be death, right? But is it normally?
No, it's not normally. Most patients that have an aneurysm, they don't have a risky aneurysm. It's kind of a low risk lesion. It's something that we can follow. Most aneurysms, we get an MRI every year to make sure that it hasn't grown or hasn't changed. So predominantly, most patients aren't dying from aneurysms, and those that do have a rupture, I mean, that's why we like to think that we have a good positive outcome and that there's something that we can do even if it does rupture. So if you do have the worst headache of your life, to go to an emergency department, there is something to do about it. But again, we're trying to prevent that worst case scenario.
Dr. Richard Daluai, who is a new neurosurgeon at Vidant Neurosurgery here in Greenville, is our guest, and I want to talk about. We're talking about aneurysms, but what can we do lifestyle wise? You mentioned high blood pressure.
Yep.
Is that the main thing? What can we do to protect ourselves?
The biggest thing is really refraining from tobacco smoking. We know that tobacco smoke causes aneurysms to develop as well as it causes them to grow. So refraining from that, quitting smoking, that's the biggest thing. Seeing your primary care doctor for high blood pressure, keeping that down. Those are the two biggest things that we can do.
So I've got my annual physical coming up this week.
Yeah.
Can you be screened for an aneurysm? Is there anything a doctor can do to kind of take a proactive approach on this?
Yeah, there's no physical telltale signs that your general practitioner, your primary care physician would be able to tell. However, if you have a family history, if you've had a sibling or a first-degree relative that has had aneurysms runs into your family, that's where we consider getting an image test to kind of find aneurysms. But
so the family history is a big thing.
That's the big key for an identifier for that awareness.
So I guess it's in your DNA.
In some respect, there's some conditions that patients are more likely to have. If you have kidney issues, polycystic kidney disease, there's some medical disorders where they're more common, but those are specific.
All right, what kind of resources are available for people who want to learn more about this? Particularly, people listen to this and they're like, "Hey, my grandfather had an aneurysm. I better check into this. What do you do?
Yeah, the best thing to do is to talk to your physician. So much of what we do, especially with specialties, is talking to your physician about what the risks and benefits are for you. That's the biggest, the best source of information.
Right.
Beyond that.
Right. Anything I didn't ask you that you want to say that would be helpful for people in thinking this thing through?
No, I think that, like anything we've seen with neurosurgery and cerebrovascular or stroke or aneurysm, with now a lot of, more attention on medicine with COVID that we've seen. But even that, awareness of these other things that are out there that are still just as important.
You mentioned stroke. What is the difference between having a stroke and having an aneurysm? Because is there any relation?
So there's two different types of strokes. There's strokes where there's a blockage in your vessel, that type of ischemic stroke, and that's most what we hear about. And then there's a hemorrhagic stroke, which is the blood inside the brain. And a hemorrhagic stroke is the effect of the aneurysm is the cause of that.
Right.
That's what we try to prevent, is that hemorrhagic stroke.
Okay. Well, listen, this is great. Great information. Thank you for coming over this morning. We were worried because you're in your line of work, you never know, right? You're probably being called in all the time to deal with this.
It's
Stan was on pins and needles. My buddy Stan Cleveland from Vidant, who sets all these interviews up for us. Thank you, Stan. And thank you, doctor. It's good to see you.
Yeah, it's always great to be here.
Yeah, Dr. Richard Daluai, who is a neurosurgeon at Vidant Neurosurgery, talking about aneurysm. So, educate yourself, just like always. I tell you, I love these segments because just points out, number one, what a great, incredible healthcare community we have here in Greenville, and how fortunate we are. Having been a lifelong Eastern North Carolina guy, we didn't have healthcare like this when I was growing up. So God bless you guys.
Yeah, thank you.
Appreciate what you do.